Welcome to Healthcare IT Today. I'm John Lynn, together with my colleague and friend Colin. The world of technology and healthcare are ever-changing in new and novel ways, and that's why we love this stuff. So join us as we discuss the latest healthcare and health IT news, meshed together in new ways which help generate ideas and new perspectives. Plus, we'll have a little fun along the way. Today, we're going to be talking about trends in healthcare marketing and patient experience, thoughts coming out of the Sway Health Live conference. And be sure to follow the show on social media at the hashtag HITSM and our personal accounts at TechGuy and at Colin_Hung. Plus, check out our 20 years of health IT content at healthcareittoday.com. So you're surviving? I see you even have the Sway Health in honor of...
I got the right banner behind me this time. I moved it. Right? Yeah. Normally, I don't feature the pink one. Normally, it's the blue one. So,
yeah, it's funny. What an event. Thanks to Meditech for hosting us and providing such an incredible venue there in Foxborough. But so many learnings and discussions happening at the event, and people should check out LinkedIn. They've been blowing up some of the key insights.
Definitely check out the hashtag Sway Health with 2 A's in the Sway part. And you'll see a lot of those posts and recaps from people. And thank you to everyone who's done a recap. It's been amazing to see all of those on LinkedIn. As one person put it to me, LinkedIn is lighting up pink and purple for them this past week because those are the 2 Sway colors that we use. So that. And it's funny, John, because we first of all, I love that venue. The Meditech Conference Center is amazing. But ironically, and maybe it was by coincidence, but there were a lot of really technical discussions there at Sway, which we normally don't have. Normally, it's a little bit more around strategy. It's a bit more around, typical marketing topics like content and so forth. But this year, there was a lot of discussions around some pretty technical topics.
Yeah, clearly every session talked about AI, I think, in some form or fashion. So I think that drove some of it. But it actually is the first topic for this episode. One of those technical things is the healthcare website. How are you seeing the healthcare website changing in 2026?
Yeah, a big topic of discussion. And I think the answer is in 2026, it is the start of a massive change to how websites need to be constructed or should be constructed. And one of the biggest changes is that websites are no longer going to be just for human beings to look at. Websites are going to have to be built for AI bots, and agentic AI, the agentic web, is coming. The easiest way to think about this is pretty soon you're going to want to go to your favorite LLM and go book me a ticket to go somewhere. And that LLM is going to go to United or whatever your favorite airline is. Says, okay, book a ticket for this and this and this based on the input I gave. And that website needs to respond. Current websites in healthcare are not built yet to handle those bots and that way. It also changes the way in terms of way information is presented. And that's already something that was discussed at Sway Health. And that is, you got to get right away to the reason why people are coming to the website. And people are no longer going to, or slowly changing the reason why they are going to healthcare organizations' websites. They're not going there anymore to just learn about procedures and learn about, general health information. They're going there with the intent of already knowing that I want to book something. That changes everything completely.
Yeah. You're 100% right. But we had the CIO panel and they described it as well. We're like, well, where are you researching? How is your researching being impacted by AI? And they're like, yeah, I go to my LLM first, right? That's a big change. And that's what's happening with patients. We're going to the LLM and saying, who are the best doctors in my area? Can you cross-reference them against scores and give me an update? We're doing, like you said, all of that research on the LLMs, on the different AI solutions that are out there. And I think that's, more tactically, what does that mean? I forget the exact stat, but someone was talking about how the number of views to your homepage is being blown up and the number of views to your other pages is going down. Because now you already made a decision. You want to go to that doctor. You want to go to that hospital. And so you're going to the homepage and just booking directly because you already did all your research on the LLM. Now, what's fascinating is that, okay, well, it's dropping down all those other pages, but those other pages are informing the LLMs what they should know about you. So it's not like you can just say, oh, well, we don't need all those other pages, right? You have to do those. And of course, there's a lot of other factors as well. Third-party sites, PR, other content, podcasts, et cetera. They're all influencing potentially the LLMs beyond it. But what does a homepage of a website need to look like? That's changing dramatically and becoming much more important.
Yeah, I think a couple of the sessions that I sat in, right away, the biggest change is the find a doc and book an appointment have to be so prominent now, right on the homepage. Mm-hmm. Can't be buried under a menu, can't be it has to be very prominent, because that is the primary reason why people are going to the homepage. As you described, they've done the research on the LLM. They know now that you are the best place to get the care that they want, and now they just want to book. They don't want to look at all the other pages, right? So you need to have that very prominent. The other thing that people were talking about, this is a very, very technical thing, is basically no one wants a mega menu anymore, right? Just because those are useless for AI. AI can't handle or doesn't know how to do a mega menu, and people aren't interested in those anymore. So again, everything is changing. I won't say because of AI. These are changes that I think people having wanted to make on websites. AI is just accelerating that need and making it more acute that you got to fix this very, very quickly.
Well, and it's interesting. One of our sponsors, shout out to Weblist, they create essentially LLM search engine solution for your website because the website is changing so much. And it makes sense when you think about what we just talked about. And to be fair, a lot of people don't trust the LLMs yet. They're not even using them. My mom and dad are probably not using them, right? But if they go to the website and then they trust that, hey, Intermountain Healthcare has this search on the website, I don't know what Intermountain does, but if you have Weblist attached to it, they can do an LLM like search of your providers, of your expertise, of your research, et cetera, so that they're getting it, but they're getting it from someone that they trust, which is your own website. So it's interesting to see that evolution where it's like, oh, so I'm going to go to the clinical website and do a search on there, but it's still an LLM bringing back the data, because that is a cool way and a usable way for a patient to be able to search through your various providers. I think that's an interesting trend as well.
So, John, next question for you. Where do you think AI, or how do you think AI is changing how patients seek and get care?
I mean, we talked a little bit about it, right? But I think the other one that we haven't mentioned, besides the fact of, hey, I'm researching a lot before and I already know who the doctor is. I got his background, I got his research, he's an expert of XYZ, that's good, But the other one is they aren't even going to the doctor. There's a whole slew of direct-to-consumer solutions, leading with ChatGPT and Google, which now Google search is an LLM along with search results, right? So, however you're using, or Perplexity or Claude or whatever you're using, right? You're asking your health questions there. And we're seeing the numbers just skyrocket between, they're not going to care because they already got the answer that they were looking for. Now, was it the right answer? That's another question that could have some massive impact. But even beyond that, I see a whole category of company that's going to develop, which is going to be that AI agent in your pocket, or on your cell phone, on your website, that you can search and ask questions and even get some basic healthcare done. Utah is testing out something kind of like that, where you can ask an AI agent and get a prescription refill. That's a preview of what's coming. It's going to happen. And that's changing how we seek care, how we get care, and and we'll see, where is it going to direct? I think those AI agents are going to become the gatekeepers. And are they going to send it to the big health system? Are they going to send it to some private docs? Are they going to send it to telehealth? That's going to be an interesting question.
Yeah, that is an interesting question. A couple of the sessions that I sat through, one with Lacey Reichwald and other panelists on AI and search, and also listening to Martha Van Berkel from Schema App talk about the nature and change of how patients are seeking care. The big thing that they were talking about is LLMs have solved a problem that both payers and providers have been too risk averse to put out there. And that is essentially typing in your symptoms and asking it, should I go? Or what kind of care do I need? You can see why a hospital doesn't want to do this, or a healthcare system doesn't want to do this, because they would be liable if they got it wrong, right? And you can see that a payer doesn't want to do this, and frankly, probably a patient doesn't believe their payer, because their payer will probably push them down to the lowest cost care and may not actually solve the problem.
Well, and we'd ask, are they lying to us? Are they just trying to drive a certain thing, right?
Exactly. But an LLM does not. So I know there's a fear that, okay, well, is the LLM inaccurate? That may be true. But the LLM is also impartial. It has no skin in the game, whether or not you go get care or not, right? And where you go get it. So as a patient, you can understand why they like this, because it's very true. If I type in, hey, I have these symptoms, should I go to the ED or not? Right? And I know the warning comes up, so I'm not suggesting that they're trying to give you medical advice. But I think a lot of times, to your point, John, it could be for something very common. Right? Like, hey, my stomach's really upset, or I got this bite, and it's got these symptoms. Is this ED time, or is it like, do I just wait 24 hours and see if it goes away? Right? Like, it's not cancer searches that people are doing typically, right? Like, it's for these smaller things. And where I'm going with this is that's driving the new behavior. Is before I would have to do all this research on my own, maybe ask a friend before I would go even try to book an appointment, because I don't even know who I'm supposed to be booking with. But do I go to an ENT doc? Do I go to an orthopedic surgeon? Right? Now I'm just doing this on AI. I'm typing in my symptoms. I'm figuring out what I need. And then to your point, they're learning through Facebook and other places. Oh, these are the other questions I should be asking when I type in my prompt. Do you accept this insurance? Rate them by rankings by looking at these other sites. Are they 5-star or not? Look at their whatever scores, right? And then come back to me with a doc who speaks my language, is in my area within a 50-mile radius, right? And then boom, it comes back with some answers, and then you go from there to book. That is all stuff, right? That's stuff we wanted.
Yeah. You painted the rosy picture, right? Like, I think there's a lot of, and I don't think you're wrong. I think there is a lot of that happening. I think the challenge is that there's probably a lot of other things that are happening where it gives them a hallucination about a doctor that isn't the best doctor, or, that they say, oh, you don't need to go in for care, this is a small thing when it wasn't, right? So we're going to hear all of those. And I actually think you're right. Like it's that low acuity question that's largely being answered. But I think also what's being asked is the super high acuity, complex 17 illness. Let me ask it because I have 17 doctors and they're not working together. So at least the Chat GPT or whatever, the LLM will work together for me, right? I think it's like both spectrums. In that middle ground, you're probably not doing it as much. And, we'll see how that evolves over time. But you raised an interesting thing. We trust the LLM because we think it's going to give us unbiased information. We're not going to the provider or the payer. I just saw a study that was done. I can't remember the exact numbers, but these are directionally accurate. And it was how many they were searching for flights. And the LLMs were giving them the more expensive flight like 80% of the time because the flight was sponsored. So, now that LLMs are trying to make money and they're adding ads to it, which I don't think they've done that for the clinical. I don't think they're doing it for booking appointments yet. But look at Google. It has the book now with ZocDoc, with CareNet, with a lot of different ones, right? Yelp just signed a deal with ZocDoc as well, right? So, that's going to happen in an LLM. And then it raises that question that you just asked. Do I trust them, and can I trust the LLM? And there's probably a space for one that says you can trust us.
Yeah, very interesting times when it comes to this kind of search. And hey, if you're just tuning in, you're listening to Healthcare IT Today with John Lynn and Colin Hung. Today, we are recapping a little bit of our Sway Health Live event that we held and pulling out the relevant information for health IT folks. So, John, here's the big one. Here's a big question for you. What marketing message surprised you at Sway Health Live?
I think this actually calls back to probably an episode we did like 150 episodes ago or something. But the message that kind of surprised me, because it happens so many times, was the power of being human and the storytelling, and essentially that if you show some humanity, if you tell the right story, if you evoke emotion in your marketing, in your efforts, that will resonate more. And it kind of makes sense in this AI slop world where anyone can create any content, but we talked about this, like I said, I think, 150 episodes ago, where it's like, hey, if you want to differentiate yourself, be human. That's the biggest differentiator, because anyone can do anything with AI. Doesn't take much at all these days to do that. And so that was the theme I heard over and over, which was, what's the story and how can you evoke emotion? One of the most interesting ones was one with Studio North and their partners, where they talked about using the emotion to, compel a very, very specific healthcare need, as opposed to, some other method, education or whatever, right? They were like, storytelling is what's going to be the most powerful thing. And I was like, wow, that makes a lot of sense. And so they actually published podcasts on this very specific thing, and they made them public on iTunes, even though I think it was for pathology or something like that. And then using that emotion in the storytelling, they were able to reach a different audience. And I thought that, I heard that multiple times, this whole idea of being human and connecting with people through storytelling.
Yeah, that was a very clear message. I think the other clear message for me, not surprising, but the clear message was just how much the conversation was centered around trust and the need to rebuild it, the need to generate it, the need to use technology to help improve it in healthcare.
How you could lose it.
And how you can lose it, yeah, very quickly, of course, using AI-generated images and things like that. But for me, the surprising revelation coming from Sway Health Live was that AI is not changing the game as much as I thought it was. It's accelerating changes that should have been made and should have been made all along. Patients want to search for health this way. I'm drawing particularly from a conversation I had with Martha, again from Schema app. And she was basically saying, like, Schema has been around since 2010, right? And if you had been doing it since then, this was a better way to identify information on your websites and mark up the content. And so it just so happens that if you had been doing that, you'd be now really prepared for the AI world. So this is something we should have been doing all along. It's just now that AI is around, everyone's scrambling to do it because it's accelerating what we should have been doing in the first place. Same thing with the way patients search for care. This is the way people should have been searching for care all along. I want to type my symptoms in, right? I want to ask a system and get some answers. I want better access to care, to an expert. And so I can't get it from a real doc, but now I can get it from an LLM. And so again, it was interesting to hear that reframing going on in a lot of the different sessions. Same with privacy. We had a whole session and a whole panel on privacy that I hosted, and we had people from Ours Privacy, from Fresh Paint. It was interesting to hear them to talk about, hey, this is all stuff we should have been doing all along, right? HIPAA compliant ways to connect with patients. And so that was my sort of surprising takeaway and surprising message from Sway Health Live was, hey, we should have been doing this stuff all along. Only AI is just accelerating it.
It is interesting when you think about that. I remember our company, Bowie Health, a while back. I don't know what they're doing now, but I remember they essentially had a search that did what you said. Tell them the symptom, and it says, should you go to the ED? Should you go to primary care? What should you do? And they reduced the number of ED visits. And they implemented it at a provider, and they saw this dramatic reduction of ED visits. And then the provider said, you're ruining our business. Like, we need the money from those ED visits. And I was like, that's not a great business, right? Hey, we're gonna ruin the revenue to your organization. And they pivoted to employer healthcare, because they're like, we don't want our employees in the ED, right? That's expensive for us. And so I don't know how successful they've been. I haven't seen them for a little while. But what's interesting now, and this is what's changed as I ponder it, it's like, oh, it's actually the same thing, just a little more sophisticated. But the big difference is it's included in just the generic LLMs.
Right.
Like you don't have to have a custom health one like they created. You can do it in the generic one. And so now hospitals and health systems, guess what? You don't have a choice. If you don't provide them the solution that routes them and navigates them to the best possible care, they're going to go do it on their own, and it's going to be available to them. So I think that's the big change that's like fascinating to see.
So John, what's the key takeaway that you have from Sway Health Live for health IT leaders that may be listening to us right now?
I think as I think about it from the health IT leader perspective, I think it's one, you need to start collaborating with your marketing person, and we actually had a session on that, which was really cool, and it was great to have Joe Diver, CIO there, along with the marketing executives. And how do you bridge that gap? And maybe we should be talking a lot more, because the IT solutions are marketing solutions and the marketing solutions are IT solutions. So I'd say that's one, key takeaway. The other one is, you need to prepare for this changing patient that's going to arrive at your door. They're coming much more educated and with many more tools. And so, you need to make sure that the tools you have help facilitate that and empower that patient to be able to do what they do. I'll give a call back to Anna McAllister, who keynoted the patient keynote to kick off the event. And when you see the hundreds of labs and devices and visits and specialists, et cetera, that she put up on the screen. And by the way, she's like, it's actually outdated. There's more than that, but it gives you the point, that is what they're going, and how do they manage that? And being able to help them manage that is going to be key.
Yeah, good point. I mean, that's a great one. I think for me, similar vein, I just think the time has now come that we need to get rid of this stereotype that marketing is separate from every other operational part of the organization, especially from a provider standpoint. Marketing used to be the only thing they needed was a website, and that was it, right? Maybe a CRM eventually, but they really didn't need access to the EHR. They really didn't need access to the infrastructure of the hospital at all. But a lot of what marketing does now requires that. We're talking about HIPAA-compliant platforms in order to even connect back with a patient. We're talking about texting platforms to communicate with patients both pre and post procedures. We're talking about wholly new website designs that need to know what that patient has done with you before, meaning they need the record, right? To know, oh, wait a minute, you're booking this appointment, but you really should be booking these other things too at the same time, right? Based on your record and all those kinds of things. So to your point, marketing and IT need to get together. And this is on marketing side too. I think marketers also have not traditionally reached out to IT and got them involved in their projects because they felt that they were separate. But it became very clear to me that one of the key takeaways is the two organizations definitely need to work together moving forward because the systems are so integrated now. And again, AI is just accelerating something that should have been happening all along. Because of AI and because of its needs and the way it's changing the way patients are getting to your door, the two groups need to get together.
Yeah, and the other message is that the CIO that just keeps the lights on, that keeps the network running, that replaces the desktops, that installs the printers, makes sure that the pager system's working, all of that, right? Like that person is, sure, you have to keep doing some of those things, but most of them are outsourcing it, and you need to become much more strategic. And these AI tools are going to allow you to be much more strategic. I mean, when I look at some of the things, I was just at the eClinicalWorks event, user event, and they showed essentially like a AI platform that anyone could build an AI solution. It's like, that's a powerful thing to allow your users to build solutions, and it's coming much quicker than we think. And so, IT needs to be part of that governance and part of that enablement. Governance doesn't mean restricted. Just like HIPAA doesn't mean you can't share. It means you need to share with the right people under the right situations. Governance means, hey, we're going to empower you, the right people to use the right information to affect change. And so it's no longer like, oh, you have connectivity. That's fine. Good luck. Right. It's now, hey, I'm a strategic part of this and I can help to enable you to be more successful in caring for patients.
Yeah, one of the big things, I'll just add on to that, John, at one of the unconference sessions we had on marketing operations, the message was very clear from our friend Shahid Shah. And that was, if an IT department, whether you're at a provider or a health IT company, a vendor, that does not allow your marketing team to have Claude or experiment with an LLM, then you're essentially hamstringing your company. But there were countless examples of, hey, they had this amazing idea to increase revenue, but the IT department wouldn't let them use X tool or Y tool, or they shut it, or they locked it down. They locked down Copilot so much that it couldn't access certain things. And so they weren't able to do it. And so rather than try, they just abandoned it, moved on to something else. But that could have generated a ton of extra revenue or made their sales efforts much more targeted. And so essentially I guess you can call it, the governance stood in the way. They were overly protective of what they were doing. So the argument that Shahid made was, you got to let some experimentation happen. Sure, You need to be careful. You need to make sure your system is secure, granted, but you need to give marketing a sandbox to play in, give them some parameters so they can go and try this thing, prove the value, and then therefore build up the case to go and make that change to your policy or adopt that other tool.
Yeah. The other thing I heard, I did the unconference around AEO, GEO, SEO. And what was fascinating is there was tons of interest. The room was crowded and most people didn't have much to say because everyone wants to figure out how to affect that and how to impact it. I don't think we know how yet. There were 5 or 6 that had some ideas and some things, but it's still a bit of Wild West in that regard.
Man, we could go on for another hour talking about this, John, but hey, we're at the end of another episode. So thanks to all of you who tuned into this episode of Healthcare IT Today. You can find out more details about our show by checking out the programs page at healthcarenowradio.com. And please share your voice and engage with the community at healthcareittoday.com and, of course, on social media using the hashtag HITSM. I'm Colin Hung, along with my friend and Health IT collaborator, John Lynn. Thanks for listening, and have a great week.